Good morning, y'all. So I ended up having to come back to the doctor this morning. After I recorded the last part of the video, regarding what happened the first time I had to come for the cyst. We found out I had it. Yesterday I was having I was headed to school, and I noticed I was tired. Like when I would get in the truck, I was tired. And so I was driving down the road not far from home, and it felt like everything was just pushing up in my stomach. Like I was having indigestion, heartburn, chest pains, or whatever. And all of a sudden, I just felt like I was going to pass out. So I got on my brakes, and I was thinking about turning around. So then I thought about my pants felt a little tighter than they had. So I kind of I put my hand and stretched out my waistline of my pants, and immediately, it's like the stuff that was in my abdomen just went down, and I got some kind of relief. So I'm like, okay, well, let me hold this for a minute, and let me just keep driving. And that's why I ended up recording the video yesterday that you just saw, because I was thinking, maybe I was kind of panicking a little bit. So I'm like, let me get my mind off of it. Hold on. So, I was trying to get my mind off of it to see if that's what it was. I was kind of panicking or whatever. So, I was just like, well, I got to school, I was having a little nausea, just a little bit. So I got to the school, and I just couldn't take my pants anymore. It's just like they was getting tighter and tighter. So I went to get me some more pants from the store. I was going to see if they would, help out. So they kind of helped out a little bit. So I just went about my day. But I had called her anyway to tell her what was going on. And she told me I could come at 7:45 this morning. So I said, well, how about I'll just see how I am the rest of the night. And I'll mess, she said, will you, if you don't come in the morning, will you at least message me? And we might can work you in on Monday, or, if you need to come see. So I said, okay. So I got there this morning. Well, actually, when I left the house, I was fine. I was like, okay, I was okay. Then, like, no less than 5 minutes later, when I left the house, y'all, my stomach started hurting me so bad. And then I ended up having to stop to get gas. So when I got off the exit, turned into the gas station, they had this bump. And oh my gosh, it felt like knives was just juggling on the inside of my stomach. I'm like, oh my freaking gosh. So I didn't even fill up. I only got about $20 worth. I didn't want to burn it out coming here already. But anyway, so I finally get to the doctor. I'm barely walking, driving here. I'm beating the steering wheel the whole way here. So, get in, they do the scan. He was like, yeah, I'm going to recommend you have surgery because it's bigger than the last time you came. And, you're our first priority and everything. So we're going to take care of this before it gets out of hand. They really didn't go into detail exactly what was going on at the time, but they were just focused. I guess they knew at that moment that I would need surgery. So, basically they worked me in this morning before, all the patients came. They were just trying to go ahead and they set me up for surgery immediately. So I just put up in the parking lot, and, I'm about to go in whenever I can stomach the pain to walk in. And the job, I just wanted to record this while I'm sitting here anyway. So, I'm going to have a laparoscopy. They said they would try to drain it first. They may have to cut me open depending on what they find. I might lose an ovary and all of that stuff, but they're going to do their best to keep everything as it should be and just remove the cyst or drain it, or remove the cyst if they have to. So, yeah, let me go ahead and get in so I can get this together. I need to call my mom back. My husband is on the way. I will talk to you guys when I get out. Hopefully they don't have to open me up because I can leave later this afternoon. I should be able to. If they have to cut me, I'll have to stay till tomorrow, but we'll see. I'm sure everything will be fine, but I be having my little intuition about stuff, and I just knew something was gonna go down. But anyway, I will talk to you guys when they prep me, I guess. I don't know. We'll see. I'll talk to you guys after a while. Bye. Hey, y'all. So I want to try to come give you guys an update. Hold on just a second. Trying to get comfortable. Okay. So, yeah. I couldn't come back yesterday because, well, for one, I was asleep all day. Well, most of the day. I think I woke up around 3 something. And, yeah, I was starving, so I kept asking when can I eat. And she finally came back in when I kind of forced myself to wake on up. And she told me whenever I was ready to go that I could go. So, normally when they do like the discharge stuff, it takes a while, but when I told her I need to get up to pee, I got up to pee. She was like, okay, good, because that's what you need to do to get out of here. So I got up to pee, came out and changed my clothes, and she came back with the wheelchair, and we was out of there. So, yeah, I got so much gas in my bag right now. It's up in here. So, we did that, and like I was asleep. The only thing I really remember is getting there, going to check in, pre-op, and then getting to the room, because by the time I finished pre-op, now mind you, I left the doctor's office, the RE's office, about 8 something, 8:30, maybe 8:40. So I drive around to find the hospital. It took me a minute to leave the clinic because I was in so much pain. So then I had to drive around the corner to the women's hospital. And I get there, and I pulled up at the place next door in the wrong place, walked there, had to get back in the truck and drive to the next parking lot. But anyway, so it took me a minute because I was in a lot of pain. So I got there around about 9-ish. Did pre-op. I think I sat in the waiting room about 30 minutes before I did pre-op. And by the time she was, printing out my stuff, my paperwork, signing paperwork, they were calling pre-op looking for me. They were looking for Davis already. So when I get back there, they had to do my testing, the COVID test. I think they did a CBC and some other stuff. I can't remember. I don't think they told me what all they were going to do, but I know for sure they did a COVID test. They were waiting on that and the other blood work. So I got undressed back there, changed my clothes. They did my blood work, blah, blah. And then they came with the other bed to wheel me to the OR. So I was kind of, I kind of remember that part because they had came in and started my IV already. So on the way to the OR, she had given me the syringe in my IV. And that was to kind of just relax me, seduce me or whatever. Not sedate me. So, I would get to the OR, I remember them asking me to scoot to the table they were going to do the operation on. And the last thing I remember is just telling her, well, in between rolling to the OR and getting to the OR, I was in this like little like holding room. It's kind of like an emergency room where they put you in those little things with the sheets or something like that. I was in there. I remember getting in there, and then that's when she put the stuff in my IV, and they asked a few other questions. And they did do a pregnancy test. They did the blood test. I don't know. I'm assuming they did the I think it's the qualitative, the one that just says yes or no. The quantitative, I think, is the one that measures exactly how much, if any, HCG is in there. So I'm pretty sure they probably did I don't know. I'm not going to say which one they did. I don't know. They didn't tell me. But I did ask her were they going to do the blood test. She said yes. And I heard one of the other ladies saying that it was negative because she was wanting to wait, make sure she had that. And so they said it was negative. So, I mean, the only way I can get a positive if implantation had not happened yet or, whatever. But at this point, I think now it will be about 11 DPO. I think 11 DPO, somewhere around there. So, I mean, yeah, I'm bummed, but, because it was like finally this cycle was going good. I had not developed an infection. I had not, I was doing well. It seemed like everything was going smoothly until Tuesday hit. So anyway, so yeah, so in the OR, I remember them lastly asking. Now, when I got a laparoscopy the first time, I remember them, wheeling me down the hall, asking me my date of birth, my name, and a few other things. And then I didn't remember anything else. This time, they actually, made me get on the table myself. I don't even remember. I don't even know. Because I told her, they said, climb over to the table. And so I started leaning. I'm like, if I'm able to make it on the table, I said, I don't even know if I'm going to be able to make it to the table. So all I remember is me being half on the operating table and half on the bed. So I don't know if I made it to the other bed. I don't know if I fell out on the floor. I don't know if I rolled back onto the bed. I don't know anything after that because at that point I was loopy. And I was kind of shocked that they let me do that because no one was just there holding me. I remember someone standing at the foot of the bed and someone standing at the head of me, but I don't remember anyone just being there. Now they may have, I don't remember, somebody might have been behind me, but I just remember them telling them, I just remember saying, I don't know if I'm going to be able to make it to the table. So that's the last thing I remember then. And then the next thing I remember is just hearing them say, no, Trey, just telling me, no, don't do this, no, don't do that. You're okay. I was waking up from the surgery. So, I guess I was, they was coming off the anesthesia, turning it off. And I remember seeing someone at the foot of the bed, kind of when my eye opened up a little bit. But other than that, I think I was trying to tell them I was hungry. I think that's what I was trying to do because I was so hungry. So, I was in a position because I remember them moving the bed. I remember them asking me, do I need to sit up? And I said, yes. So they sat the bed up some. And I think they sat the foot of the bed up some. So they did something because I was uncomfortable. And I was just trying to adjust my body so I wouldn't be so uncomfortable. But I guess they thought I was trying to get out the bed and pull some stuff. I ain't gonna say I wasn't, but I don't think I was. But anyway, so I remember them just, talking to me, telling me it's gonna be okay. You're just waking up from anesthesia, blah, 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 this kind of stuff. And then the next thing I remember is I was back in the room because I heard my husband. I think I remember hearing them wheel me in when they wheeled me in the room, because I heard one of them say something about she did good in surgery or something like that. But I wasn't awake. I could just remember hearing it. After that, I heard my husband talking on the phone whenever he would talk on the phone. And I really don't remember anything else until I woke up around 3-ish. I remember asking the nurse, when could I eat? I don't remember seeing her. Well, I could see her a little bit, but not just like fully awake asking her this. I was still pretty sedated. And I asked her what I could eat and things like that. So then when I finally did wake up, around that time, I heard my husband talking on the phone. He was telling someone that the doctor said that the cyst had partially ruptured and it was bleeding. So, because their intention was to go in and first see if they could just drain it, you know, do like the simple steps first. And if they had to go to the next step, they would, but only they wouldn't just go in and just try to take the cyst out, or they wouldn't just go in and just take the ovary or whatever. So anyway, they went in and with the intention of just draining the cyst, but by the time they got in, it had ruptured. So they he just had to take the cyst out. And he said, well, I heard my husband saying that there was a thin, because it was like thinner than paper, you know, paper thin wall of the cyst still left, that I think he left it there because, you know, I think at that point it would be damaging the ovary if he tried to do anything else to it. I don't know. I haven't gotten any really details about that. Maybe he came in and talked and thought I was awake. I don't remember hearing the doctor talk at all. I don't remember any of that. And I was kind of shocked that he didn't come in when I was fully awake. That's what I'm saying. I don't know if I was awake and then maybe they thought I was awake. But I didn't hear anything. I don't remember seeing anything. But who knows? He never did come back the rest of the day. Like I said, when I finally woke up, the nurse came in and I told her I had to pee. And then then I was gone. Like, nobody came and talked to me about anything. So, I got my paperwork. They did give me pictures of my cyst. Well, they gave me pictures. But honestly, I didn't know what I was looking at. Not really. I could see a lot of bleeding and things like that, but that's about it. So after that, I got home and I went back to sleep. We got in the bed and I went back to sleep. There was a severe thunderstorm last night. I slept through every bit of it. I woke up to go pee, to eat, of course, again. And I could not get enough eating yesterday. And to be honest, I still can, I'm constantly hungry. I'm so hungry all the time. So, that was that. Before the surgery, he told me, of course, we would never know what we would find when we got in there. So, I'm assuming everything else was fine. I had started having some pains on my left side of my ovary yesterday. So, hopefully, it was just the small cyst, or it may have been the irritation from this one rupturing that had gotten over there. And also, I did notice when they were checking my blood pressure afterwards, after the surgery, it was down to my normal, 120. I remember one of them being 122/69 or 122/70-something. 120-something/70-something, but I felt a lot better, and in my mind I'm thinking that had to have been the cyst that was causing the chest pains. My chest was hurting, I would feel so tired, out of breath. And what prompted me to go to the doctor in the first place was because And I know this might sound weird, but like I have dreams. I'm a very, very vivid dreamer, and a lot of times they are true. So months ago, before I started taking the letrozole, I had I kept dreaming, like constantly, like days and days. I would dream that I was like dying, but I never died in neither one of my dreams. And how I would like almost die in the dreams would be, something was keeping me from breathing. Like I could breathe. It was like getting harder and harder for me to breathe, but I never completely died. So in a couple of particular dreams, I was taking some medication. I don't know what it was in the dream, but I just remember taking some medication, and whatever medication I was taking in the dreams, it was what was causing me to almost die. And so when I started having the breathing problems, the day before I went to the doctor, the second time, when I started having the breathing problems, that's what made me think about it. Okay, I'm like, okay, I've been taking the letrozole, and here I am now with a problem. And it was always, in my chest, things like that. The dreams, they were always something dealing with my chest. So I'm having the chest pains. I can barely breathe, when I'm exerting myself. Even sometimes talking, like I would get out of breath just talking. So I thought about that, and I'm like, and I had already been thinking about that dream ever since then. Like every now and then I think about it, trying to figure out what it was. And so that started happening. I'm like, Lord, is this it? Like, what is this with the dream I've been having? And I can only just say yes, because it happened. I'm not gonna say the exact way, but this is what was going on. Me taking something, causing the pain, the chest, and me not being able to breathe. So I'm glad I did go to the doctor when I did. I'm glad she allowed me to come in, because, I was trying to explain to her without sounding crazy that, she knew I had the cyst, but I was asking her, if that could be the cause of me not being able to breathe when I exert myself. And, I don't know what happened with that, but, yeah, so I just, she told me to come on in, because, if I was concerned, then they wanted to check me. She said that I didn't need to be stressing or anything like that. And overall, they just wanted to put me first and, make sure I was okay. So I went in, that morning, and I'm glad, I did. So here's on to day one of recovery. So far, I just have tons and tons. Yesterday, I could move about better than I could yesterday. Well, I only left the hospital and came home and got in the bed and got up to pee, and that's it. I had a lot of, shoulder pain and chest pain from the gases that they put in. Other than that, today is the day after surgery, and I having a lot more gas pains. I try to get up and walk as much as I can, because that helps. I can't lay on my right side, or else it's just severe. I have 3 incisions, or 3 incisions, the little holes. They plastered those, dermoplast, and they kind of hurt every now and then, depending on how I move. They sting as if they try to, peel open, but try to keep that, try not to make certain movements so they won't do that. I think one of them did. 1 or 2 may have started to bleed a little bit, but because I had it on my pillow, but I didn't notice anything else just coming out. So let's see, I've had some a little bloating, but it's not bad bloating at all. It's just, like I said, the air. Other than that, I can get up. I'm sore. Like today is a little because a lot of the medicine is wore off. They didn't prescribe me anything. She asked me, she said, she told me, she said, yeah, they're getting away from these doctors prescribing, medications, in a lot more instances now than they used to. I said, well, that's fine. Like, I don't really like to take anything anyway. But I told her, I said, if I needed to, I have some stuff at home. So she said, okay, that's good. But she did ask me if I needed anything. I just told her no. So, I haven't taken anything at all. So, I mean, I have a high pain tolerance, but this is more just like a lot of soreness. There's nothing. I have like some sharp, like scratching pain, not stabbing pains, but like a sharp scratching, if that makes sense, like in a tiny area. So it's nothing unbearable. Like I said, this is the second laparoscopy I've had. So I think this one, though, is a little more. I have a little more soreness than I had the last time that I can recall. The last one I had was in 2017, I believe, the end. So, I mean, this one is, okay, I ran out of space, surprisingly. Anyway, so I'm going to just wrap the video up. But, yeah, so this one is a little bit more sore than I recall the last time. But overall, like I said, I haven't had to take anything. The most pain I have really is the gas. And that's really nothing that, I can take anything for. So, like I said, I just get up and walk and it'll pass. But other than that, I don't know any plans as far as, what I can do afterwards, because initially we were just gonna, if the cyst would have stayed there, we would have just skipped the next round with no letrozole and then did monitoring on the next cycle to see where the cyst was and maybe determine what we're going to do after that, because she said it would take a while for the cyst to go down on its own. But now that they've cut it out, and they said it was a possibility if they have to leave any of the wall, then it could come back, but I don't think it's anytime soon. So I have a follow-up in 2 weeks. So I have a trip to Texas, so hopefully that'll take some things off of my mind. Well, I have my follow-up before then. Then I'll be going to Texas. I don't know. I hope it doesn't put like too much of a hold on it. I mean, I know I got to take care of myself, but at the same time, I don't know. It's just whatever at this point. You kind of, like I said, thought everything was going well, and then boom. So, like I said, it's the weird stuff that goes on with me. It's just the most random stuff. So anyway, y'all not gonna be able to see me out the wild if I keep recording. I will talk to you guys at I guess I might try to do some stuff in between, but if not, I'm gonna try to recover this day. I'll probably come back with my recovery tomorrow and over the next few days. But as for now, I will see you guys in the next video. Bye.